You're up to 75 bucks now. In the studio, and I want to do this first. Kay Butler is with us.
Kay Butler started RN the Know. Kay, what do you do?
I am an advanced practice nurse, and we close gaps in healthcare.
Explain a little about your clients.
I notice time and time again, our patients don't understand the end-of-life care situations that arise. It's much easier to have the conversation prior to the crisis, and that's what I'm striving to do. I just feel like I've been given all the talents, the skills, the education, and to be a bright light in a very dark topic.
And what else do you do at RN the Know?
I do American Heart basic life support provider courses. I also do Heart Saver courses, and then family and friends. And so I do a full range, and it's from the medical professional to the person who just wants to learn how to become a hero.
Kay Butler, RN the Know.
I just feel like I've been called to do it.
And Kay just told me that she does the CPR and all that training free for churches.
Yes. They won't get a card, but I'll give them a little certificate at the end. It could be me laying outside of the 7-Eleven one day, and I certainly want somebody to resuscitate me.
That is true. And we were joking the other day, but it's true. CPR nowadays doesn't include mouth to mouth.
Not for people in the community. I do teach healthcare providers how to use barrier devices, which are like face masks,
Right.
with an ambu bag. But for the most part, the community, we just teach hands-only CPR, just to keep that blood going.
And I saw something the other day. It was a picture somewhere of a device that a rescue squad was using that went around the chest and actually did the CPR pressure.
Yes.
On the chest.
I can't think of the name of it right now. But yeah, that allows the person providing the care to kind of turn to the people around and let them know what's going on. This is what we're doing. And it avoids the fatigue.
Yeah.
When you're giving CPR, if you don't feel like you need CPR, you're not doing it right.
Really?
Yeah.
So, excuse me. Anyway, it is good to have you again. Mr. Welcome texted on Danny's Autoglass and Mirror studio line. Go outside right now and take a look at the moon. He said it's incredible.
It's beautiful. It's in Virgo this time.
Virgo?
Yes, it's in Virgo.
Which means what?
It's just the sign that it's in.
Oh, okay. All right. See, I don't know that. I'm a Cancer. It's never in my sign. At least that's what my wife tells me. So, RN the Know, you do so many things, but all of it extends either from the home, an individual, all the way out to a big company.
Yep.
And does that cover the whole spectrum of what you do?
Yeah, people ask me, what do you do? And I kind of look at them and say, what do you need? I can do so many different things. Health education is important, and I'm finding that so many people don't understand what the physician tells them.
Absolutely.
And they have kind of odd ideas because they're basing it on their own view of life. And I can help people understand exactly what's going on, from diabetes, heart failure, hypertension.
No, what you say is true, and I have always been a big encourager for people to ask questions. I grew up in a day and age when my grandfather, myself, we went to the doctor, and the doctor said, "This is what's wrong," and you went, "Okay." And he said, "Here, take this," and you went, "Okay." And now, and I think doctors appreciate that too when you go in and ask questions.
Well, people a lot of times don't ask the questions because they don't want to appear ignorant.
I do it daily. It doesn't bother me at all.
So often when I was in the hospital setting working in critical care, the physician would come in, say their spiel, and be gone. And then the people would look at me and say, what did he just say?
Yeah, I've had that before.
And the physicians are pretty unaware of that. They think, oh, well, they nodded. Yeah, they seem to understand, but they really don't understand and don't want to appear stupid in front of a physician. But I can help people with that. I break it down. I take complex ideas and break it down into bite-sized pieces to where you can grasp what's going on.
Do you work by yourself?
I
you
do,
have
I
people
do.
that work for you?
No, I don't. It's just me. I have people have told me to stop saying my office because it's truly a facility. I have a suite of offices over on Thimble Shoals. It's a pretty nice place. I
You
talk.
have a suite of offices for you?
I do. I have one space that is very open where I talk to people about end of life care decisions. People seem to feel trapped when you kind of talk to them about these things. So it's
Absolutely.
a very open atmosphere. Very.
Well, I have to, I'll interject here that I found it very uncomfortable when my neighbor, Mr. Bud, was getting bad and people were coming into the room to talk to him. And I was in there, even though I was his power of attorney. I just found it weird that we were talking about this in front of him.
Well, that's the beauty of what I do. I try to get to people before that painful situation. When you are in the moment, you're unable to process things logically. If you come to me, anytime before you get ill, before the crisis, it gives you the opportunity to process what I'm trying to tell you. And then when the moment comes, then you can pull that out of your back pocket and use the information.
Yeah, because we had personally a couple of situations many, many, many years ago. I think it was 30, 40 years ago. We had a little girl, my ex and I, with a very rare birth defect. And the possibility of her living was slim to none. And when the doctors came in and talked to me, they went through this whole spiel and they said, now, do you want her on life support? And I went, yes. And then I went, whoa. I didn't hear a word you said.
Yeah.
And oftentimes in those situations, you don't hear a word they say. So if a scenario is coming up, can somebody use your service to be there to help with decision making or to advise or to direct?
Absolutely. I would be willing to move mountains to help someone. That's the whole reason why I started my business. I truly want to help people understand. People think that I have like an ulterior motive. Trust me, I'm not making a ton of money. I just really want to help people. I've seen so much misery in my 25 years as being a registered nurse. I'm not there to sell them a coffin or a life insurance policy. I truly want to connect the dots for people.
And I think that is very, very important. Let's talk about your training for CPR. How do people contract you to come and do this?
Well, they can go through the American Heart Association site, or they can go directly to my website, www.rn, like registered nurse, know.com. It's all one word. Go to the second page and it'll cascade out testimonials of my teaching abilities and all of my...
Cascade out.
Yes, it will. Or they could call me.
Now, do you do anything from a family to, I said a large company. Can you handle just about any size?
Well, I can only do 6 at a time if they require a card, but I can do up to 12 at a time for family and friends. And I also do churches free, just to spread the word.
What is the difference between a card and a certificate?
Well, a card is usually required by someone's school or employer.
Okay.
And they have to renew it every 2 years. Just to learn CPR, I'll be happy to come out and teach people up to 12.
And that's, like you say, simply a certificate saying that you had it.
Yes. And you just essentially walk with the knowledge.
I have to ask you, because it is every newscast, everything. The coronavirus.
Yes.
They're talking about COVID-19, I think it is. I hear so many different things 18,000 people have died from the flu this year.
Right.
We've lost, 200 to the coronavirus in the United States, something like that, maybe a lower number.
I think
15.
Yeah, it's much lower.
Are we overreacting?
No. I washed my hands before it became the thing to do. But really, that's one of the best things you can do to protect yourself is to wash your hands, keep your hands away from your face if at all possible, and just to keep washing your hands. You can use a tissue or something to touch, like a door handle. Just think of those high-touch areas that everyone is touching.
Now, I saw someone the other day who said that we do not know to this point how long this virus stays on a coffee cup, a counter, a pen, a pencil, a sink, or whatever the case may be. They have not, it has not been around long enough for them to determine this yet.
Yeah, and we're hopeful that it's going to subside during the warmer months like the flu does, but we don't know yet.
Yeah, it's very scary. I'll ask one more thing along that line. I also heard an expert say all these people walking around wearing masks, it's useless.
Well, if you are sick,
correct,
then wear a mask. What's happening, unfortunately, are the medical professionals don't have the supplies because people are they're taking them, and it's very disappointing.
Do you do you work with doctors also? Coordinate with doctors? What happens there?
I do mobile cognitive evaluations. Usually I'm called in by social services or someone like that. I will do a full cognitive eval. It takes about an hour and a half. And I have an electronic health record that's secure. I shoot that to the primary care physician and certainly will engage with them if they have any questions.
Now, are these done to determine the well-being of the patient in living alone or whatever the case may be?
It determines their ability to make sound decisions. So I don't say whether they have capacity or incapacity to make healthcare decisions. My assessment is sent to the primary care doctor who makes that determination based on my assessment.
It's hard to get a grasp of exactly what RN the Know does because you do so many things. If you were trying to put the RN the Know experience in a nutshell, how would you do it? So that people could say, I'm going to call RN the Know on this.
Well, I'm highly compassionate, highly experienced, and highly educated. But I have that the ability to talk to people in a way they understand what's going on. If they are in a situation where they're unsure which way to turn, how to best follow their physician's instructions, they can come to me. I can help them understand their disease better so that they can manage it on a day-to-day level. People come to me for education about end-of-life care. If they want to see the tubes we use, I show them what CPR looks like. Most people don't understand. They base their judgment on what they see on television, and it's very far from the truth. CPR is brutal. We do CPR on so many people we probably shouldn't be doing CPR on. In a healthcare setting, the resuscitation rate is only 12%, and that's when we have all hands on deck, all the meds we need. The caveat to that is people in the hospital are generally sicker than those in the general public.
12%?
Yes.
Really?
Yes, that's very low. And so when you bring someone back, you have to take into consideration what you're bringing them back to. If they've already had a devastating stroke, what are you bringing them back to? So you have to balance quality versus quantity. And that's an individual decision. That's not a decision I make, but I bring the evidence to people so that they can make their own decisions. I'm also an officer of the court. I can notarize advance directives. They don't have to be notarized, but everyone over the age of 18 should have an advance directive. It is not
and
just...
what does that say?
That tells the healthcare team what your decision would be if you are unable to speak for yourself. It only has two pieces. If you were in a vegetative state, would you want the kitchen sink or not? If a doctor says your death is imminent, do you want to continue full court press or do you not? And it also addresses organ donation.
It gives me chill bumps. It's very hard to discuss, and
It's a serious topic, you know, but our culture is so backward. We don't discuss death, and I think the reason why we don't discuss it is because we do wait for the pain to set in. You know, if you can come talk to me beforehand, we can kind of have a good time talking about things because it's all imaginary at that point.
I don't remember who it is, whether I read it or somebody said it to me, but if you put it into perspective, we begin to die the day we were born.
Well, this is the youngest you're ever going to be.
Yeah, thank you, Kay. You're done now. I really appreciate that.
Well, you know, life is a gift.
Yeah.
And I'm of the belief that this is not, there's more to it than this. We're here to face challenges, overcome barriers, and to help people.
So how do people get in touch with RN The Know?
As I mentioned before, my website, www.rntheknow.com, or they could give me a call, 757-869-8529.
You closed one eye when you did the
Well, I
number.
was thinking about my cell phone. And I must say, if anyone does try to get in touch with me this week, I will get back to them next week. I'm going to a National Clinical Nurse Specialists Association conference. I'm leaving on a plane this afternoon.
Now, are these people that do what you do?
These are my people.
Okay.
I am like a unicorn of nursing. No one is out there doing what I'm doing.
I know.
Most clinical nurse specialists.
That makes it very hard to describe.
I know,
too.
I know. Most CNSs work in facilities. If you open up nursing textbooks, you will notice that a lot of the textbooks are written by women like me, women and men like me, highly educated people.
Okay, thank you very much again. And have a safe trip. I understand that there are many, many seats on planes to be had right now.
Well, hopefully I'll have smooth sailing. I'll just keep my hand sanitizer. I've got some tissues to touch some spots, and we'll do fist bumps or foot bumps instead of shaking hands.
Okay, thank you.
Thank you so much, Neil. I appreciate your time.
RN The Know, everybody. It's 7:22.